So this is our COVID-19 care package outreach event. So what we've been doing is traveling to a lot of different Creek Nation community centers, and what we're doing is we're just setting up a drop-off a drop-off location or a drop-off station so people can pull in, so they don't have to get out of their car. It's limited contact. And what we're doing is we're passing out bags here that have different information and different items that families can use if they're at home and maybe they're needing some different activities to do as a family unit. So we've created some packages here that have information regarding behavioral health needs to kind of help cope with things that are happening with COVID-19. We realize that there's been a huge impact on not only financial hardships, but also mental health hardships as well. And we realized that, so we wanted to create a bag that helped provide resources for people who may be struggling with that as well as a result of COVID-19. So we have that. We have things such as dominoes, playing cards, some therapeutic items like foam or like little bendy straws, just something to help people know, help cope with everything that's been going on. We've had mostly citizens here, but we've expanded it out to everyone. So far, we've probably had approximately 375 bags that we've passed out since then. And our goal is to actually start moving further north. We've kind of targeted the more southern communities at first because we felt like the resources down there were a little more lacking than maybe the northern community, so we focused there. But we haven't forgot about the northern communities. It's just for the time being, we only had X amount of bags to use, and we actually have some leftover ones, so we've kind of started migrating towards the north communities as well. There will be more events, hopefully more virtual trainings as well, more outreach and awareness. So we're really, at Behavioral Health, I think we're doing a really good job at getting ahead of this pandemic and what I think is to come, which is that mental health crisis as a result of COVID-19. So we're wanting to get out into the community right now and just kind of be preventative and preemptive on how we get those resources out there to community members and let people know that we're available. We've created a mental health kind of a crisis number from Monday through Friday, 8 to 5. So if you're feeling stressed out, you can call one of those numbers and speak to a licensed professional counselor and speak to somebody about whatever's going on. And then we can actually set up a appointment with that person, telemed, if somebody's struggling. For employees who are feeling a lot of stress as well, we actually have an employee stress line as well. So people can call that number and speak to one of our staff who have been trained on how to kind of de-escalate or kind of help process some staff members' stress that's happening as a result of COVID-19 as well. But if they want to call, the employee stress line number is 918-758-1930. And you can call one of us, like I said, and just speak to us, because even at Behavioral Health, I mean, we feel the same way. I mean, we're really stressed out too, but we're also here to help